Elsewhere, doctors at the Federal Medical Centre Asaba have staged a peaceful protest over an assault on one of them by patients over the weekend. The doctors who marched around the hospital with placards say they want justice and punishment for the act to deter anyone from assaulting medical personnel. Untitled has more and will return with business news.
The incident happened here at the Accident and Emergency Department of the Federal Medical Centre Asaba over the weekend as the assaulted doctor, whose identity is concealed for security reasons, narrates what transpired.
I was called to review a patient. It was actually a consult. So while in the process of doing that, in a bid to document the patient relative of the patient I was asked to see came up and started an altercation with me. We were asked to go our separate ways. When I was going to attend to another patient in the main medical annex, what I saw was three guys that came, and then all of a sudden I noticed that I was bleeding from my head. I didn't know what was used to hit my head.
In solidarity with their colleague, these doctors are protesting the incessant attacks on them, which are worsening their working condition, in addition to poor remuneration and insufficient personnel at the medical facility.
Because doctors have been continually assaulted. Not only doctors or health workers, but in this instance, a doctor was assaulted and almost killed in the accident and emergency for no just reason. So we are out to educate and express our displeasure to the populace. It's a law case. The assailants are presently in the cell. They've been in custody since on Saturday. So that is the message we want to pass out, that from now, doctors won't keep quiet and fold our hands again.
We've come to our wit's end. I'm sure we've never protested. Yes, we down tools the other time that we were attacked, but we've never come out like this to protest with placards.
Please, when you have any issues, channel it to the next person on call. From the first person you see, there is a senior, there's another senior, and then there's the consultant, and then there's the management.
This assault of medical personnel only brings to the fore the need for government to address shortage of doctors, which is exacerbated by the high brain drain of doctors due to poor welfare.
There are many things making us leave the country. People are pressured, the economy is not good for the doctors, we are not well remunerated. Now we're not adding assault to it.
In the last 2 years, about 9,000 doctors have transferred their services to the United States of America, Canada, and the UK. Ikenna Amechi, TVC News, Asaba.